My grandfather recently passed away last year. He had dementia. Yeah. The memories. That's where our culture stems back from. It's our history. If we don't learn from our elders, we'll lose the path of the future.
Teaching them about their culture and their language is very important because that's their heritage.
It is sad that that a lot of these stories are being lost, one, because they're not being captured, or because of early illness such as dementia and mental health diseases as well.
Elders are so important to our communities that we want to keep their memory strong.
You hear mostly about the heart and stuff like that, and you don't hear much of the brain, brain's the most important, one of the most important parts of your body. It's your library.
So when it starts to affect your day-to-day life, that's when they think, okay, we might need to start looking at, do you have dementia?
Alzheimer's type dementia is still the most common in Aboriginal and non-Aboriginal people, and vascular type dementia. But the good thing is that the risk factors for dementia in Aboriginal people really are modifiable, so there's a lot that we can do to prevent it.
There's a lot of other health factors such as chronic disease that Aboriginal people suffer at a greater rate than the non-Indigenous population, such as diabetes and other lifestyle factors, all of which are contributing factors to early onset of dementia.
So we found, unfortunately, that dementia is more prevalent in Aboriginal elders. It's about 3 to 5 times more common.
When I was working back up in the Pilbara, I realised there was a gap between Aboriginal people within townships and within communities and how they accessed healthcare. And although there was lots to offer and lots of access to funding for healthcare, it really stopped Aboriginal people being able to access. They still struggle to access healthcare.
So there has to be more education to those families so that they'll be able to understand what dementia is all about. They'll be able to help their family member if that's what's happening to them, you know.
Communication with Aboriginal people is really important, particularly in health. And so for Aboriginal people with yarning, it is about telling that health narrative or telling the story about themselves or what's going on.
You're better off framing it in the Indigenous perspective, which would be, you could live longer and look after your grannies. Imagine those stories that you can tell rather than, but you'll be healthier. It's not so much for yourself, but it's what you can do for others. And I think there's a lot that we can learn from that different perspective. I work at Centre for Aboriginal Medical and Dental Health, and that's a centre within the School of Medicine at University of Western Australia. It's an Aboriginal-led and directed centre, and our expertise, I suppose, is in Aboriginal health research, working in community-based research with the community, looking at health priorities of the elders within the community. So we focus on elder health and wellbeing.
DAMPA stands for Dementia Risk and Management Program for Aboriginal Australians, and we're looking at Aboriginal people 45 years and above and looking at to see whether they are showing possible early signs of dementia and looking at their brain health overall.
I was asked by the people in the DAMPA program to design a logo, and so I got to work and came up with the brain. Blue is my favourite colour. With this particular painting, it's based about the blue is emptiness and the loss of memory, and with the beautiful colours that comes out, it just shines out to bring out a little bit of healing, inspiration, and the process of moving forward with this condition.
There is no cure for dementia, so prevention is, I guess, the focus.
So looking after your brain from when you're born all the way through to when you're an older person. So it's really important, the education that you have strong families, and can look after, you know, the kids and bring them up well, through to midlife when looking after your sugars, your diabetes, and looking at keeping your heart strong as well, and exercising and all the things that you know are good for your health.
The old tools don't necessarily capture the specific needs of Aboriginal people.
So we developed the first, internationally, the first assessment tool for cognition in older people, for Indigenous peoples, and it's called the Kicker. The Kicker's now been adapted for use around Australia and is in health service protocol and policy and practice.
So the Kicker is the Kimberley Indigenous Cognitive Assessment, and that is being utilised to assess specifically Aboriginal people, being mindful that it's culturally appropriate. And what that is, a 10 to 15 minute short memory screening test that we use. And that in the scoring, it can show that someone could have potential early signs of dementia.
Yeah, it's a great tool because it's specific to the needs of Aboriginal people, Aboriginal elderly specifically.
I want to be tested, you know. I mean, I forget things sometimes, but it's not, hey, I haven't got dementia yet. Oh, well, I don't think I have. But, you know, this program, I think, will be really something to highlight the fact that, yeah, they are doing something about dementia in Aboriginal communities.
So we have an Elders Governance group that we work with through all our research, so they can inform us of their aims, I suppose, or objectives or outcomes they're looking for, and we can adapt what we're doing as we go along. Exercise sessions where they can have a yarn, have a talk, and also do something for their own health.
I think there's been great strides being taken in more recent years with the development of different yarning tools that doctors, other health professionals can use to communicate effectively with Aboriginal people using clinical yarning, but also using yarning in different styles, ways that you're able to connect with Aboriginal people, whether it's in the community conducting research, whether it's in a health setting, in a clinical setting.
If nothing else, I think services can start to do that and really develop trust within the community and start delivering on some of those promises as well and some of the priorities.
And a lot of people forget about our elders. You know, once they're gone, they're gone. In our family setting, you know, we'll never forget what our parents and our old people actually done for us.
It's quite sad that dementia as a disease can, you know, take away thousands of years of knowledge in quite an instance.
It makes it harder for us, younger generation or the future generation, to understand what's happened in the past, or just the knowledge of, you know, traditions and, you know, cultural traditions within their clan group.
It's very important that we address dementia earlier, and why we look at all the factors that are contributing towards dementia much earlier, and creating more awareness about these factors and things that the Aboriginal community can improve.
I suppose we want to focus on strong elders and happy elders, and when you have that, then I suppose all the cultural knowledge and the role they have in caring for their families and teaching about cultural ways can be passed on. And then we're hoping the government will say, well, that's a great program, slot that in, and you've already done that with the health services, let's keep that going. So people start thinking about brain health, not just heart health, and the importance of that over time, you know, to prevent things like dementia.
Kate, she's amazing. She wants to make a difference for everyone. She would love to see this go national.
Everything is here for our people to be able to be treated the right way. But people got to take care of their own bodies, you know. It's responsibilities both ways.
I think it's worth coming along and having a conversation at least about it, getting assessment, because it provides a peace of mind. It provides the opportunity to say, okay, well, this is one thing that I can actually manage now if I need to.
Those are the people that we need to sort of get to and sort of say, yeah, this is here, you know. You want to be a part of it.